Welcome to section 2 of this growth and development series. So, now let's talk about cognitive development, which is really just a fancy way of saying how people think, learn, and make sense of the world. The main theorist you need to know here is Jean Piaget. Piaget believed that children are active learners. They're not just sitting there absorbing information, they're constantly interacting with their environment and figuring things out for themselves. Piaget described development as happening in stages. And his key idea was that kids have to move through these stages in order. You can't skip a stage and you can't rush it, which is important for nursing and patient education. Now, HESI tip, okay, if a question says, how does a child learn? And the answer involves interaction, exploration, or hands on learning, think Piaget. Now, Piaget identified, again, those 4 stages of cognitive development. HESI absolutely loves asking you to match age, behavior, and stage, so we're going to walk through these clearly. The first stage is the sensory motor stage, which goes from birth to about age 2. Infants learn through their senses and physical movement, touching, tasting, grabbing, shaking, putting things in their mouth, for instance. One huge concept here is something called object permanence. I'm going to repeat it for a reason. One huge concept here is something called object permanence. This means the infant understands that something still exists even when they can't see it. So, a common HESI question that we see is if a baby cries when a caregiver leaves the room or plays peekaboo successfully, that's object permanence, which happens in the sensory motor stage. Okay, they don't have object permanence yet, so they think that the caregiver actually left when they didn't. Next is the pre operational stage, which typically includes toddlers and preschoolers. This is when language really takes off and kids start using symbols, like pretending a block is a phone. But their thinking is still very egocentric, meaning they see the world only from their own perspective. They have a hard time understanding that other people think or feel differently than they do. So, a tip here is think of egocentric thinking as everyone sees the world the way that I do. Now, the concrete operational stage usually includes school age children. These kids can think logically, but only about things that are concrete, meaning things they can see, touch, or experience directly. That's why hands on learning works so well at this age. Abstract ideas don't really click yet. So, if a school age child needs visuals, examples, or hands on teaching, they're in the concrete operational stage. The final stage is the formal operational stage, which starts around age 12 and continues into adulthood. This is where abstract thinking develops, things like hypothetical situations, future planning, and moral reasoning. Not everyone reaches this stage at the same time, and some adults may not consistently use formal operational thinking in all situations. So think abstract thinking, adolescents and adults, which is formal operational stage. Now, one important thing to understand is that cognitive development doesn't just stop after childhood. Several theorists expanded Piaget's ideas into adulthood. So, June Loevinger believed that adults continue to develop cognitively and emotionally through changes in self awareness, moral reasoning, and relationships. Her theory reminds us that adults mature over time. How someone handles stress, conflict, or responsibility at age 25 may look very different at age 55. Now, this supports the idea that patients grow and adapt, especially during life transitions. Now, Robert Keegan built on this idea even more. He believed development happens in cycles, periods of stability followed by periods of major change. His theory helps explain why major life events, like becoming a parent, dealing with chronic illness, or retirement, can completely change how someone sees themselves and the world. So, why does all of this matter for nursing? Okay, because how someone thinks affects how they learn, how they cope, and how they follow instructions. A school age child needs concrete explanations. An adolescent may challenge rules. An adult learner benefits from understanding why something matters. As nurses, we adjust our teaching and communication to match the patient's cognition level, their cognitive level, not just their age. All right, so a bit of a shorter section here, but some high yield takeaways. Okay, so Piaget, think how people think. Sensory motor, think object permanence. Pre-operational, egocentric thinking. Concrete operational is hands-on learning. Formal operational is the abstract reasoning. Okay, and teaching must match the patient's cognitive ability. All right, in the next section, we will be going over sociocultural and humanistic theories. I'll see you in the next one.